You see a patient who complains of eating more, drinking more, and urinating more. So don't miss this. Patient, think of diabetes mellitus. Okay. So whenever a patient presents with polyphagia, polyuria, and polydipsia, we always suspect diabetes mellitus, right? Now in this video, we'll understand why this happens, especially what is going on at the cellular level or in the brain. In a simple mechanism, I'll explain why these things happen. Okay. First, we'll see polyphagia, right? Polyphagia meaning increased food intake. Okay, now let us quickly understand why polyphagia happens. And food intake is controlled by the hypothalamus, right? There are two important centers. One is ventromedial nucleus, the other one is the lateral nucleus. So these two centers control food intake. Ventromedial nucleus is the satiety center, and lateral nucleus is the feeding center. Normally, remember the feeding center is active. Okay, the feeding center is active, and that's why we always feel hungry. And when the feeding center is active, what we do is we take food is taken. After food intake, the blood glucose rises, and this blood glucose reaches the satiety center neurons. The satiety center neurons, we also call it as glucostats, right? Glucostats is nothing but these are the satiety center neurons. Here in red color I have drawn the glucostats, right? So what you see here, this red color neuron which is drawn here is your glucostats or the neurons, and these neurons are activated whenever glucose enters into these neurons. And for the entry of glucose into the satiety center neurons, we need insulin. So there is insulin dependent glucose uptake by the satiety center neurons, nothing but the glucostats, and these neurons are activated. Once this glucostats are activated, it will inhibit your feeding center. So the feeding center is neurons are inhibited, and so always you feel full. So I'll repeat the cycle again. Okay, when the feeding center is always active, okay, so what happens is this will continuously keep firing. So the person takes food. After food intake, we know our blood glucose level rises, and that glucose now reaches the hypothalamus, that is the satiety center neurons, and there is a insulin dependent glucose uptake, and these satiety center neurons are activated, and they inhibit your feeding center neurons, and we feel the fullness. Now after about 2 or 3 hours, what happens? The blood glucose level decreases, right? After taking a food, after about 2 to 3 hours, after all the digestion and all, the blood glucose will reduce. So once the blood glucose reduces, the satiety center neurons are not activated. Then what will happen? There is no inhibition of feeding center, so the feeding center will again become active, and we again start taking our food. So this cycle keeps on repeating in our day-to-day life. Okay, now in diabetes mellitus patients, why these people will always feel hungry is the question we are discussing now. Now, in diabetes mellitus patients, we'll just see what happens. Okay, first always start with the feeding center. So the feeding center is always active. So we take food. The diabetic patient also takes food. The blood glucose rises in him. Once the blood glucose is increased, now see here. So the blood glucose is very high in diabetes mellitus patients, but it needs insulin to enter into the satiety center neurons. So the problem in diabetes patients is they don't have insulin, or the insulin receptors are a problem. So when insulin is not there, this glucose cannot enter into the neurons. The satiety center neurons are not activated. When satiety center neuron is not activated, it cannot inhibit feeding center. So in diabetes mellitus patients, no, this feeding center is always active. So that is why they always feel hungry. So the problem in diabetes mellitus patient is at the neuron level. We always suggest the patients to control food intake, but usually if you see, the adherence to your suggestion is very less in diabetes mellitus patients because of this, because it is the drive in from the feeding center which makes them to eat more and more, because the feeding center is always firing. In a normal person, what happens? Once we take food, the glucose enters into the satiety center neurons with the help of insulin, and that inhibits your feeding center. But not so in diabetes mellitus patients. The feeding center is always firing, and that is what leads to polyphagia, and that is what leads to polyphagia in diabetes mellitus patients. So the patient keeps feeling hungry, and we call this as polyphagia. Now next we'll look into why polyuria. So I've drawn the diagram of a nephron here. You can see the nephron, and this is the afferent arteriole, this is the efferent arteriole. And you see the afferent arteriole, it will form a glomerulus here, right? And this purple color molecule, what I've represented is glucose. And we all know the blood glucose is very high in diabetes mellitus patient. Because the glucose is high, it gets filtered in the glomerulus, and all the purple molecules here, no, these are your glucose. So there is a large amount of glucose molecules. Remember, the glucose is osmotically active molecule. It means similar to sodium ions. So glucose also draws water. Wherever glucose ion goes, water also follows. So now since the glucose is filtered, what will happen? Along with that, water is also filtered in the glomerulus. And this glucose and water, okay, now it will be lost in the tubules, and finally it will be excreted in the urine. So this patient, diabetes patient, has more and more frequency of urination because he has large amount of glucose in his blood, because the cells are not able to utilize because insulin is not there. So because of that, glucose is filtered in urine. Along with that, water is also filtered, and this is what leads to increased urination or increased frequency of urine formation or urination. So because the patient is losing more and more water, the patient has polydipsia. Because of the excessive loss of water in urine, the patient becomes dehydrated and the thirst center is activated, and that's why the patient drinks lot of water. That is called polydipsia. So remember, more the patient is eating more, he's passing urine more, and he's very thirsty. And whenever you see a patient with these three symptoms, always think diabetes as your first diagnosis, okay? But always remember, there are differential diagnoses which you need to think, but the most common cause of these three symptoms these days is because of diabetes mellitus. So for more such simple medical explanations, please do check out the video section for similar such videos, and don't forget to like, share and subscribe to this channel. And I hope you have understood the three mechanisms of polyphagia, polyuria and polydipsia.